Hello, welcome to Raaonline. I am Dr. Raaonline. The topic is anatomy of the salivary glands. As we know, there are three major salivary glands: parotid, submandibular and sublingual, apart from multiple glands in the oral cavity. Coming to the parotid gland, this is the largest gland of all the salivary glands. It is placed between the mandible and mastoid process in the preauricular area. It extends from the zygomatic arch on the top to the mandible angle of the mandible at the bottom. It has an anteromedial, posteromedial and superficial surfaces, otherwise called lateral surface. So borders are superiorly the zygomatic arch. Posterior superior is external auditory meatus and the ramus of the mandible. Posterior inferior is mastoid process and sternomastoid muscle. Inferiorly sternomastoid muscle and anteriorly masseter muscles. These are the limitations of the parotid gland. Coming to the relationship, lateral surface is covered by investing layer of the deep cervical fascia, fibers of greater auricular nerve, platysma and skin. This is the palpable surface of the parotid gland. Medial or deep surface lies on the buccinator muscle. The most important point to remember in parotid anatomy is the ever-threatening facial nerve. Facial nerve, as you know, is a motor nerve to all the facial muscles which are responsible for facial expressions. So, facial nerve, the seventh cranial nerve, enters the parotid gland after leaving the sternomastoid foramen. Within the substance of the gland, it divides into superior and inferior division. The superior division is called temporofacial division and the inferior division is cervicofacial division. The gland that lies medial to the nerve is called a deeper lobe and that lies lateral to the nerve is called superficial lobe. Another important anatomical point to remember is the external carotid artery. The external carotid artery passes through the gland on the posteromedial aspect of the gland and divides into its terminal branches, maxillary and superficial temporal artery. Coming to the venous system,